My topic is the effect of sitagliptin on cardiovascular outcomes in type 2 diabetes. Diabetes is divided into type 1 and type 2. Diabetes is a long-term condition that causes high blood sugar levels. Type 1 diabetes is when the body doesn't produce insulin. Approximately 10% of all diabetes cases are type 1. Type 2 diabetes is when the body doesn't produce enough insulin for the proper function. Gestational diabetes is a type that affects females during pregnancy. Heart and blood vessels disease, also called heart disease, includes numerous problems, many of which are related to postcode atherosclerosis.
95% of all diabetes is type 2. However, you don't have to be overtly obese. In other words, it's mainly the distribution of fat in the abdomen or visceral area that is the main risk factor for obesity, or for type 2 diabetes. Tom Hanks, as I understand it, has actually improved his diabetes with weight loss. And now he's pretty slim, and I think his diabetes control has been improved. And that's typical of most people with type 2 diabetes. When they exercise and lose weight, their control of their diabetes improves. It's also known that physical inactivity by itself can cause this syndrome of insulin resistance and predispose you toward type 2 diabetes. So physical inactivity, visceral fat accumulation are the two main causes of type 2 diabetes. There are also some genetic susceptibility to it. So some individuals are more susceptible. We don't know all the reasons for that. Well, I think that's a good point, that this is going to raise the level of interest in type 2 diabetes. And people begin, as they get older, begin to lose muscle mass, begin to develop visceral fat accumulation. Most of us, as we get older, start losing the muscle and accumulating fat in the visceral area. The large amount of muscle mass is what allows you to dispose of glucose after eating a meal or eating a glucose-heavy meal. And when you lose muscle mass, that in itself can make you pre-diabetic. So what we need to really think about is, getting screened for diabetes, getting screened for glucose intolerance. There's a test, simple test, where they'll give you a glucose load, 75 grams of glucose orally. And then they measure your insulin levels and your glucose levels and determine how well you can dispose of that glucose. Well, I think it's great that Tom Hanks has really stepped forward. And David Letterman, on the David Letterman show, as I understood it, also pointed out that he had trouble with glucose control. I think that this sort of indicates to people that you don't really have to be really obese in order to have a risk for diabetes. Diabetes now affects something like 26 million people in the country, and most of them are type 2 diabetic. We used to call that adult onset diabetes, but now we're seeing this in children. So I think the fact that folks like David Letterman, Tom Hanks, who come out and talk about their difficulty in controlling the glucose is really going to make people more aware that anyone who's physically inactive, older individuals and many other individuals are going to be facing the possibility of pre-diabetes and then later development of diabetes. And I think improving our activity, reducing our visceral fat is certainly the most reliable way to prevent type 2 diabetes.
Data are lacking on the long-term effect on cardiovascular events for adding sitagliptin or dipeptidyl peptidase 4 inhibitor to usual care in patients with type 2 diabetes and cardiovascular disease.
Type 2 diabetes occurs when your pancreas does not produce enough insulin, and your body is resistant to the insulin that is produced. Insulin is a hormone that helps your body use blood sugar, known as glucose, for energy. Your body takes the food you eat and breaks down fat, protein, and carbohydrates for energy. During the digestion process, the carbohydrates from your food are broken down into glucose. Glucose is absorbed into the bloodstream where it is carried to cells throughout your body. A healthy pancreas releases a regular supply of insulin into your bloodstream. After you eat, your blood glucose levels rise, and your pancreas responds by releasing more insulin to move the glucose into your cells. Insulin acts as a key, opening up the cell so it can accept the glucose. In a person with type 2 diabetes, your insulin receptors are less sensitive. Though your pancreas continues to produce some insulin, it is not enough to meet your body's needs. When your body's cells are less responsive to insulin, it is more difficult for glucose to enter the cells and raise your blood glucose level. As a person with type 2 diabetes, it is important to monitor and maintain healthy blood glucose levels. Over a long period of time, high blood glucose levels can lead to serious health complications such as heart attack and stroke, blindness, kidney failure, and nerve damage. By getting daily physical activity, eating a healthy diet, and taking your prescribed medication, you will decrease your chances of developing complications from diabetes.
Application in medicine. In this randomized double-blind study, we assigned 14,671 patients to add either sitagliptin or placebo to their existing therapy. Open-label use of anti-hyperglycemic therapy was encouraged as required, aimed at reaching individually appropriate glycemic targets in all patients. To determine whether sitagliptin was non-inferior to placebo, we used a relative risk, 1.3, as the marginal upper boundary. The primary cardiovascular outcome was a composite of cardiovascular death, non-fatal myocardial infarction, non-fatal stroke, or hospitalization for anesthesia. The pros: sitagliptin was non-inferior for placebo for the primary composite cardiovascular outcome. Rates of hospitalization for heart failure didn't differ between the two groups. There were no significant differences between those groups. Cons: the primary composite cardiovascular outcome was defined as a first confirmed event of cardiovascular death, non-fatal myocardial infarction, non-fatal stroke, or hospitalization for unstable angina. Secondary outcomes include the occurrence of individual components of the primary composite cardiovascular outcome, fatal and non-fatal myocardial infarction, fatal and non-fatal stroke, death for any cause. Additional perceived outcomes include change in the glycated hemoglobin level and the EGFR initiation, and additional anti-hyperglycemic agents or long-term insulin therapy, and the frequency of severe hypoglycemia.
Are you excessively tired? Find it difficult to quench your thirst? Maybe you find yourself going to the toilet more often, or you can't quite satisfy your hunger. These symptoms could mask the fact that you have diabetes. If you experience temporary or permanent loss of vision, a tingling pain or numbness in your hands or feet, or cuts and bruises that are slow to heal, you could have diabetes. All of these symptoms point to one thing: they are all symptoms of type 2 diabetes.
Conclusion: among patients with type 2 diabetes and established cardiovascular disease, adding sitagliptin to usual care did not appear to increase the risk of major adverse cardiovascular events, hospitalization for heart failure, or other adverse events.
Type 2 diabetes is a complex condition, and it can be especially confusing for patients who are in their early diagnosis. Diabetes affects the body's ability to control glucose, or blood sugar, which is what the body uses for fuel. Everyone produces glucose through the food we eat, and maintaining the right amount of blood sugar is essential for good health. With type 2 diabetes, the body begins to lose its sensitivity to insulin and the ability to produce insulin, which is a key hormone that helps regulate glucose. With decreased sensitivity and levels of insulin, blood sugar can spike to dangerous levels and stay there for prolonged periods of time. Dramatic swings in glucose levels can affect different areas of the body and cause symptoms such as fatigue, hunger, and increased thirst. As type 2 diabetes progresses and becomes more advanced, higher than normal blood sugar levels can begin to damage nerve cells. It can degrade eyesight. It can also contribute to skin, kidney, and bladder infections. Later stage diabetics may require regular insulin injections to help control their condition. In the initial stages of the disease, many patients experience no symptoms at all, and doctors are only able to determine if someone has type 2 by administering a blood test. Patients with early type 2 are generally able to control the condition by modifying their lifestyle to help control blood sugar levels. Some of the most important changes include quitting smoking, controlling related conditions like high blood pressure, exercising, losing weight, and making dietary changes. Not only is a proper diet important for overall health, it can also help lower blood sugar levels. Eating a meal causes blood sugar to rise naturally. By focusing on foods that have a low glycemic index, like choosing whole grain bread or lean protein over regular white bread and sugary drinks, it's possible to dramatically change how much your blood sugar rises after a meal. In addition to lifestyle changes, your doctor may prescribe a non-insulin oral medication to help further control blood sugar levels. There are several classes of these medications. Some of these drugs help the body to produce more insulin. Another type works in the liver to limit glucose production. And another class of medications works to remove excess glucose from the bloodstream. One of the newest types of these drugs prevents excess glucose from being reabsorbed through the kidneys and helps to expel it naturally. Managing type 2 diabetes can be challenging at first, but by modifying your lifestyle and working with your doctor to develop an effective treatment plan, diabetes can be a manageable condition. If you'd like to learn more about treating type 2 diabetes,
To finish, issue applied in Ecuador. In Ecuador, chronic non-communicable disease, such as diabetes mellitus and hypertension, have experienced a sharp increase in the period 1994 and 2009, rising significantly more pronounced in the last 3 years. To face with this situation, the Ministry of Public Health monitors and evaluates all diabetic patients through the implementation of all the clubs in diabetics, where doctors, nurses, and nutritionists that provides comprehensive care.
Over the long term, high blood glucose levels can cause several complications. The most serious are heart attack and stroke. Diabetic neuropathy is a common complication whereby the nerves that connect the spinal cord to other organs are damaged. The feet are often affected due to poor circulation and nerve damage. Diabetes also affects the kidneys, causing nephropathy, where kidneys lose their ability to filter waste products. Diabetes can damage small blood vessels in the retina, causing diabetic retinopathy. This may result